He is the author of Toxic: Heal Your Body from Mold Toxicity, Lyme Disease, Multiple Chemical Sensitivities, and Environmentally Acquired Illness. Dr. Neil Nathan, welcome.
Thank you.
Chronic fatigue is the end product of a very complex interplay of factors, isn't it? And so
Yes.
why is it that sort of traditional medicine, the traditional medicine approach, should I say, to sort of medical care does not always apply to these cases?
Very interesting question. It's always difficult to understand why colleagues think the way they do or don't think the way they do. It may have to do with the history of chronic fatigue as it appeared. We began to see it at the beginning of an epidemic in the early 1980s. And when it first appeared on the scene, it was not really understood by colleagues. And as medical people do, some of the first assumptions was, well, you're just a malingerer. This is in your head. This is not real. You're not really fatigued. And, stop being a slacker, get up and get going. It did not appear to me, starting to work with those patients the way I did, like there was anything psychogenic about it at all. This was very real. It's always fascinating to me how some medical practitioners will cling to an idea even when the information that they're getting or their senses being with these people would make it clear, no, this is not psychogenic. This is very real. And yet, a number of important politically based entities, both in the UK and in the United States, have long maintained that chronic fatigue syndrome is a psychological illness. Hence, why look for any causes? That's silly. Take whatever antidepressant or anti-anxiety agent you want and go away. Leave me alone. And unfortunately, even though it has become increasingly apparent over the years that this is not true at all, that chronic fatigue is, as you are saying, it's an end product of a wide variety of physical assaults on the body that still has not been fully embraced by medicine, and that's being kind. But it got more complicated over time. So it went from the late 80s and early 90s, when I could help the vast majority of these patients just by giving them adrenal support, magnesium, thyroid support, etc., to I could do those same interventions, but patients weren't getting well in the same timeline. They were still struggling. So it became obvious that there were other things we needed to be looking at that we hadn't realized were also players here. And then we began to recognize Lyme disease. Then we began to recognize mold toxicity. Then we were again able to help the majority of patients, but the treatments became more complicated. Treating Lyme disease and mold toxicity is a lot more complicated than giving a little bit of adrenal support. And our patients began to get increasingly more sensitive and more toxic. So they went from they could take anything I wanted to give them easily to even minute doses of the medications and supplements that should work would really throw our patients under the bus. They would react very badly to them. Even tiny doses of homeopathics would have that effect. And so for most of us, it seems clear that what's been happening is the world that we are living in is becoming increasingly toxic at a rate that is not being appreciated. In a sense, we've always called our patients with chronic fatigue and fibromyalgia the canaries in the coal mine. So we are now seeing an epidemic of chronic fatigue and fibromyalgia and Lyme disease and mold toxicity and neurodegenerative diseases and autism and on and on and on and on. And for most of us, it seems clear that we're talking about a global pandemic of toxicity in addition to our current pandemic of COVID. So to me, that is the issue. And unless we wake up immediately to this level of toxicity, we're all going to be sick before long.